Chris Weber has been an avid hiker for years, so when she injured her knee, it did more than limit her mobility. It took away her passion. And from personal experience with knee injuries, she knew what kind of treatment she could be facing.
My mom's had both of hers replaced. I had an aunt who had hers replaced. I got friends who just had them done recently, and I don't want to go through that again.
Fortunately, Chris didn't have to. She'd torn a small hole in her cartilage, and doctors were able to fix it by using a patch of her own tissue. Weeks before surgery, doctors took cells from a healthy part of Chris's cartilage. Then
we can harvest those cells, send it to a lab where they actually grow and expand those cells. And then we can actually implant those back into the patient.
Dr. David Flanagan is the surgeon at Ohio State University Medical Center who did Chris's surgery. This is what the patch of tissue looks like. But before it gets to the operating room, it's actually grown in a laboratory. The patient's cells are put onto a type of mesh and allowed to grow. And once the patch of tissue gets big enough,
they can actually freeze the cells. And they hold them in kind of hibernation until it's the appropriate time to go ahead and proceed with surgery.
It's a technique that worked well for Chris. She may still need to have a knee replaced someday, so she's not out of the woods just yet. But in a very real sense, the woods are exactly where she wants to be. And this technique made all that possible.
Dr. Flanagan gave me my life back. I was down to the point of not being able to do hardly anything of what I was used to doing. He really gave me my life back.
At Ohio State University Medical Center, this is Clark Powell reporting.